Now let's talk about pulmonary hypertension. So remember, the normal pressure is 15 to 25 mm of Hg, okay? So the pulmonary artery pressure is more than 25 mm Hg, okay? Pulmonary hypertension is defined as mean pulmonary artery pressure of at least 25 mm Hg at rest, which is measured by right heart catheterization. So there are basically of four types: 1, 2, 3, and 4. Remember, remember, 1 is associated with a genetic mutation of BMPR2. So when there is mutation in the BMPR2, okay, so BMPR2, you have to remember the name, okay? Say with me, BMPR2, BMPR2, BMPR2. So BMPR2 mutation, if there, then there will be vasodilator will be decreased. Vasodilators like nitrous oxide and PgI2, okay? So it will be decreased, and vasoconstrictor will increase. So that is endothelin will increase, and that will lead to pulmonary vasoconstriction, and pulmonary vascular resistance will actually increase, okay? In type 2 PAH, what will happen is, remember, 2 2 and in 2, remember, two lettered word, heart failure. So it's a two-lettered word, BMPR2, first of all. Second one is heart failure. So what happens in heart failure? So if there is left-sided heart failure, the cardiac output will decrease. If the cardiac output will decrease, what will happen is the left end diastolic volume will increase, right? So that will lead to black flow of blood. That will lead to increase in the pulmonary congestion, pulmonary capillary wedge pressure will increase, and that will lead to pulmonary hypertension, isn't it? So in type 3 PAH, remember, in 3 remember, OSA, ILD, three lettered word, and one is uh, chronic obstructive disease. Of course, this is pulmonary disease, right? So it's a 4 letter, but just make it 3 letter. We need to remember, no? So OSA, ILD, or COPD. So these are the chronic illnesses. So chronic illnesses will lead to chronic hypoxia, and that chronic hypoxia, when created, will actually lead to pulmonary vasoconstriction. It will lead to increase in the peripheral vascular resistance, and that will lead to hypertension. Now type 4, it's a 4, right? It's type 4, and this 4 is associated with a pulmonary embolism, okay? So 4, make it E like, however you need to remember, okay? So type 4 is a thromboembolic disease that will lead to thromboembolism formation, and that will lead to pulmonary increase in the pulmonary resistance, okay? Now, what are the clinical features? The patient will present with all the signs and symptoms of respiratory conditions like shortness of breath, fatigue, easy fatiguability, right? And if there is fluid filled up, second to edema, what will happen? Orthopnea can happen, okay? Orthopnea due to fluid filled up, right? But you need to say that palpitations, fatigue, chest pain. You can say syncope also, okay? Syncope also can be seen. Palpate, look into the respiratory secretion. So if there is edema, bilateral basal crepitations is felt. So if it's a case of OSA, you might look into a small mouth. You just examine all the cases, okay? If it's a signs of heart failure, so you can see pedal edema, you can see orthopnea, paroxysmal nocturnal dyspnea, OSA, ILD, COPD. So if it's a COPD, you can see that there will be this pursed lip breathing can be there, or there can be central cyanosis, right? In the case of emphysema, there will be pursed lip breathing. And if it's a case of embolism, if you just there can be this some form of cardiac, some form of respiratory depressions, right? Okay, so interstitial lung disease, you can just rule out. Features of rheumatic arthritis, cognitive tissue disorder may be there, right? Now, whenever you look into chest X-ray, so there can be chest X-ray. What can you find in chest X-ray? So pulmonary arteries might be, it might look enlarged, okay, and go for right heart catheterization. Okay, ECG right ventricular strain pattern. In ECG, you will see a right ventricular strain pattern is seen in ECG. Okay, so chest X-ray can be done. Okay, chest X-ray can be done. Chest X-ray, what we'll see? So pulmonary arteries is enlarged. So you see here the pulmonary arteries is enlarged like this. Okay? Pulmonary arteries is enlarged. Okay, and there's right ventricular enlargement. Okay, got it. Now management. How are you going to manage this case? Go for diuretic therapy. Okay, should be prescribed for the patients with right heart failure. Okay, just prescribe the diuretic therapy. Okay, now supplemental oxygen must be given to maintain oxygenation. Anticoagulants, digoxin for heart failures. Vaccination, nitrates. The cause must be treated. Okay, so I think you can write something about nitrates about pulmonary hypertension. Thank you.